Hi everyone, welcome to another episode of IzzyDoesIt. If you're watching from YouTube, you can see that this set is different from our usual set because the conversation I will be having today with our two guests, one from MOH and one from Shena, is about managing psychosocial health and empowering workplace well-being in conjunction with World Day for Safety and Health at Work. Yes, it's a mouthful. This is a very important episode for everyone to listen to because not only are we having conversations around psychosocial health, that encompasses mental health as well. But MOH and Sheena also have something very special to share. It is a very big step towards acknowledging how important it is when it comes to mental health and our psychosocial health. This episode is sponsored by Sheena, so I want to thank Sheena for making this happen. Without further ado, please enjoy this episode.
My name is Muhammad Ihti Shamuddin Haji Abdul Ghani, Ihti for short. I am the Human Resource Officer 1 for the Safety, Health and Environment National Authority, Shena.
I'm Shahmun Matasan. By training, I'm a clinical psychologist. Have been working with MOH, I think almost 2 decades.
Wow.
But only recently, well, it's not that recent. I think about 7 years or 8 years ago, I joined Health Promotion Center as the mental health strategic lead.
As I mentioned earlier, we're here to discuss a very important topic, specifically managing psychosocial health and empowering workplace well-being. The thing is, I have never heard of the term psychosocial health before. It's usually mental health,
Yes.
right? So maybe we should begin with that. What does psychosocial health mean?
Izzy, honestly, throughout my years in Ministry of Health and especially now in Health Promotion Center, when I do go out to the public and talk about mental health or even psychosocial health, most people in the general public will say, amongst the first thing that they mentioned is actually, I need a vacation. Right. So the sort of first diagnosis of psychosocial health, if you like, that they give to themselves. But actually, psychosocial health, it's much broader than that. Yeah. So what we're really referring to is a person, our overall mental health, psychological and social well-being. So all that in one, encapsulated in one word, psychosocial health, right? So it's not just the absence of stress or burnt out, but it's really talking about how we as individuals think, behave, how we feel, how we connect or interact with other people in our lives. It also describes, our ability to cope with life's challenges and how we perform effectively at work or at school and maintain a meaningful relationship with others. So in other words, essentially, psychosocial health talks about things like resilience, our relationships, our sense of purpose in this life, and how well we cope with life challenges or when things doesn't go as we want it to be. So, which let's be honest, it happens quite often, more than people wants to admit sometimes. So basically, psychosocial health, it goes deeper. It's about our day-to-day functioning, about our resilience, and like I mentioned earlier, quality of life, but essentially both in and outside of the workplace. All right. So, but today we're talking about psychosocial health in workplace.
Workplace.
Yes.
Yeah, psychosocial health in workplace.
Yeah.
Yes. Okay, so let me just try to summarize what you
Yes,
just
it's quite
shared.
lengthy.
Yeah, it's quite lengthy because for people who have not heard of psychosocial health before, maybe it's also like a bit confusing for them because mental health is the buzzword that we keep hearing everywhere, especially the Gen Zs.
Correct.
They are the ones who I feel like put that term in the mainstream media and also in most conversations.
Mental health is affected or rather impacted by 3 different factors, which is the psychology, the social health, so it's
encompasses all of
encompasses all of it.
because whatever happens to you, psychology, whatever happens to you in your social life, who you're
Circle,
exposed
yeah.
to, whether at work or in
Correct,
personal,
correct.
it affects your mental health.
That's right.
So basically, psychosocial is the
The
overall
overall, yeah.
thing.
Yeah.
Okay.
Yeah.
Thank you so much
Yeah.
for
worries.
sharing that with us. Okay, now I would like to throw the question to Tuan Ihti because you're from Shena, right? So can you share more about this safety month and how it connects to the World Day for Safety and Health at Work?
All right, sure. So the Safety Month is organized by Shena as part of our support for the World Day for Safety and Health at Work, which is a global initiative by the International Labour Organization (ILO), held every annually on the 28th of April. So the aim of the World Day for Safety and Health at Work is to promote the prevention of occupational accidents and illnesses. So Sheena uses this platform in the form of Safety Month, where we organize various programs and discussions throughout the month to basically raise awareness and strengthen the workplace safety culture in Brunei. So that's how connection of Safety Month and the World Day for Safety and Health at Work is.
Okay, and then why is this topic about psychosocial health and empowering workplace well-being selected?
Okay, so this year's theme is pertaining to having a healthy psychosocial work environment. So this is why it's quite timely that we have it for this particular topic. So it's about trying to say that workplace safety is not just about physical safety, but also to do with employees' well-being and to make sure that people are, safe to work in a healthy environment. So that's the gist of it all. So what we want to try to achieve is that we want workplaces or workplace safety is not just about physical, but also making sure that employees are mentally well, and then we want it to be part of the overall workplace safety strategy in the workplace. So that's the aim that we want to put to look at it in a more holistic view of workplace safety. Yeah.
That's amazing because you're right. As because Shina is usually safety, but physical safety at work, and I'm glad that you're using this time and this platform to also highlight that it's important for people to be healthy mentally as well.
Correct.
Why is it more important to talk about psychosocial health in today's workplaces?
From a organization perspective, I think workplaces are now more complex. You would say there's high expectations now, and there's also the fact that we know with advancement of technology, there's a lot of ways for people to contact people just outside of working hours. So it's hard for people to disconnect. And there's also this, I think now with the new generation as well, there's this trying to balance with work and personal interests. So the work-life balance is much more prominent than it was before. And also the fact that I think maybe sharing my own experience, when we talk about resilience, during my time, resilience was all about enduring in silence. So if you I don't know, during that time, so it's about
Yes.
tahan saja.
Yeah.
Kalau in a
We
way.
belong the same era.
Right, I was just about to say.
So I can relate.
Yes.
Because I was just about to say, it's in my time. Like, it's like, how long ago
yeah.
was that?
Not just
During
your time, in
then.
our
Yes,
time.
during our time. So I think now being in HR, you get to talk to a lot of people. So I'm fortunate enough to be in this profession to talk to a lot of people. And then you realize that a lot of people are experiencing mental health challenges. And one of the things that I realized personally is also that now resilience is about coping in a healthy way and looking at it in a way that when you reach out to people, you talk to people, and then you don't have to deal with problems yourselves. So that was different back then. So it got to a point where personally, I learned two things. One is about it grounds you in a way. It makes you feel that you appreciate things more that you have in life as opposed to what you don't have in life. And secondly, you become more empathetic to people's punya itulah challenges nowadays, and also the fact that you it makes you realize that, don't forget to reach out to people, and also to reach out to yourself as well. Self-care is also important. So I guess the point I'm trying to make is workplace are now changing a lot, and it will change in the future as well. So there's more I guess focusing on the mental side, or the mental or emotional side of things. I think just going back to what psychosocial health in the workplace comes in is where, just to put it simply, it's how the work, the social relationship, and the work environment affects people mentally and emotionally. So that's very important that we, why the topic today is very important.
If I may add on
Yes,
as well,
please.
Izzy, I think simply put, again, looking back to my time or our time, there's the simplest way to put it is because I think work has changed a lot over the years, and people, or the generations that actually are working currently are actually have changed as well. But in most cases, how we manage well-being hasn't caught up, hasn't changed. Like you mentioned earlier, kan, like people are saying, kalau dulu, if anyone or someone feeling overwhelmed at work, the solutions are quite simple. They said, well, ada dua. Kau boleh tidur saja, or just sleep it off, or buat saja kerja.
You suck it up.
Exactly, suck it up. Make it worthwhile, and you just work harder. Kali lah macam tu. But we know that's not working, isn't it? Usually, kalau these pots of how shall I best describe it? This important matters is not being looked after for some workplaces lah. This is where it starts to affect the employees' engagement, performance, motivation. And so now there is a clear need for every organization. Sorry, bercakap pasal organizations pula. But I do see it in the clinics as well. You see people coming in and telling us that they're experiencing physical illnesses, sakit kepala, mau sakit kepala, dia dapat tidur. And yet when we looked and sit down and discuss about things, it's more than that. So there is definitely a clear need for us to actually take hold of this matter into our hands and really, really think through what can be done. It's not macam like tadi we mentioned, buat tidur kerja saja. Itu macam orang membaiki atap rumah bocor.
Yes, without trying to find the root of the issue.
Correct,
Yes.
right? So it'll always be leaky, if
and
you don't
you're gonna
find the
keep
root
repairing
cause.
it, but it's not gonna solve the problem long term.
Exactly. So I think that's why I guess it's becoming more and more. It's trending. People talk about mental health in workplace, well-being in workplace, improving the psychosocial health of our employees. It's very important though. So it's Alhamdulillah, Brunei is, I think, now more open to discuss about these matters.
Yeah, which is why I mentioned earlier, like how mental health has become a buzzword. It's not necessarily a bad thing.
Correct.
Because it's now at the forefront of every discussion to ensure everyone is protected. Because mental health is a real thing, and it's merijapnya orang because you don't see it physically.
Yes, it's very subjective as well, so it's difficult to quantify.
Yeah, because it's so broad.
Exactly.
But from both of you punya experience, whether it be professional or personal, what are the most common workplace-related mental health issues that you see?
I suppose this is more from the clinical point of view pula. In Brunei, similar to global trends, the most common workplace-related mental health issues that we do see in the clinics include people coming in with depression and anxiety disorder, as you mentioned earlier. These are actually widely reported in clinical and community services our mental health services . And more often than not, as I mentioned earlier, yang interestingnya, when they come or when they do show up in our clinics, people don't usually walk in and saying, I'm burnt out, I'm stressed, but they'll say things like, I can't sleep. Or if I sleep, I keep on waking up. And then, I'm having trouble to have a good night's sleep. And I'm always tired. I don't know why, padahal dah kerja berhabis, tapi I feel tired. Well, they think they're in the kerja berhabis, that kind of thing. And I'm getting headaches all the time, or migraines and whatnots, yeah. And so these are actually, when we do sit down and discuss about things, I'm talking about psychological punya treatments, and when in therapy sessions, we do find out that they're often linked to workplace pressures or interpersonal challenges that they face in the workplace, or life stresses. So I wanted to share this actually, because when I was preparing for our discussion today, I remember one of my patient before was saying that, datang ke tempat kerja tu belum ku parking, sudah ku macam kabak-kabak. And then I will parking sekejap, lurus ku parking, dan keluar ku balik, pusing-pusing, trying to motivate he or himself, she or herself or himself, to motivate myself to actually step out and go to work. I think I'm allergic to my workplace. Now, we laugh about it. It sounds funny, right? But deep down, when we really dig deeper, it's sad. I mean, when we come to the real distress, it's actually workplace is putting that, which is, kesian satu, and sayang, because these are supposed to be our mata pencarian, right?
Yeah, and we spend most of our day at work, 8 hours.
Exactly. It was must be really, really uncomfortable for that person, because they were having palpitations, anxious pulang di tempat kerja. So again, like I said, what I really want to highlight actually, with this question of yours, that kadang-kadang kan this sort of what do you call it, issues in the nampak. So that's why it's important for us to actually pay attention to it, because sometimes people don't want to talk about it. People just keep mum about it, right? But yeah, it's out there. There's a lot of even common mental health issues that's actually linked or related to workplace stresses.
From an organizational perspective, I think the common is the stress, obviously, and the burnout, obviously with excessive workload. And I think especially in Brunei, there's a lot of people who's wearing multiple hats. So that's one of the common theme, and that could lead to stress. And some of the things that I think the problem also, we normalize this. So stress is just normalized. It's something that's normal, just tahan saja. It's normal in this job and all that. Yeah, there's also people with anxiety, especially fear of making mistakes.
Yes.
That's common.
Yes.
That's common that we see every day.
That's
So
true.
why don't you want to share ideas? Because biar telah,
Takut salah
takut salah
cakap.
cakap. So that's where I guess probably psychological safety is important, to make sure that we create an environment where people are free to, or safe space to speak up without feeling embarrassed ataupun ada repercussions. So that's very important for organizations to take care of. Yeah.
I was going to ask this question a bit later on, but I want to ask it before I forget.
Okay.
Then how do we then build resilience mentally? Because the topic is there's good and bad things when something is being like highlighted, discussed, because people will then easily use that as a weapon. Oh, aku mental health issues, and then that discredits people who actually do have mental health issues and who actually do need assistance, right? So there's layers to these questions. Satu, how can that individual build mental resilience, and how can the workplace help that individual build mental health resilience? And then how to discern person who use that as an excuse and a person who's actually like going through stuff.
I think most of the things, first and foremost, that I'd like to highlight to everybody, we do receive a lot of questions about this. Macam, benarkan tu, iaitu ada issues with mental health-nya. Di office saja cuma tu, like, usulnya cuma tu. Tapi di luar, okay je ya. That kind of thing. We often hear that, and it is true. While there are people who are actually struggling and having the actual clinical symptoms, but there are also people who use it, like you said, as a weapon and use it, misuse it. So it's very important, first and foremost, for us to know what are actually the common symptoms dulu, because more often than not, when we talk about mental health issues or mental health illness, the early symptoms itu ramai orang, it's easy to overlook basically. Because in the semua dramatic. Kalau nya dramatic itu there's a question mark pulang tu.
Oh, bahkan actually when someone's like overreacting tu pulang macam okay.
Yes, because usually
lah.
people who's actually so people who's actually going through it, people tend to miss it pulang. Because it's not dramatic, it seems insignificant, and then like I mentioned tadi, declining performance or contribution or concentration. So you do see the person in the office, but they're not there. You get what I mean? We talk
physically
about,
they're
yes,
there.
physically there, but brain
mentally
atau indada di sana. So this happens a lot of the time. So Ani relates to tu ni, increased absenteeism. Okay, absenteeism we know that's orang dia datang kerja, but there's a lot more nowadays. There's studies that shows that there's a lot more cases of presenteeism. So orang datang kerja, present, tapi not entirely there. You get what I mean? You just roll into work, switch on your, I don't know, laptop or whatever it is that you have, but not doing anything because they just can't brain things that day. So orang apa, the brain is not braining.
The brain is not braining.
Yes, right. But not macam like I said, sejam dua is fine. It happens to the best of us. There are times when we feel, aku kan buat kerja. Like, I mean, low motivation ku sikit or like ngaleh kueh, sehari okay lagi dapat diterima. But when you see this happening day in, day out, there's something wrong, and we know this is because of not because of external social events ke apa yang drain energy or whatever. This is just them being them, normally yang performing or can focus tapi ani hindi dapat, and increased frequencies of physical complaints. So ani macam ngaleh, like I said tadi, headaches, migraines, because jarang orang ani can having all these physical complaints kalau inda ada the root cause of it lah, and difficulty in making decisions, even simple decisions of well, it happens to every one of us, mana makan lunch, mana saja, but that's fine, but then this every other decisions that usually orang itu sanang-sanang membuat, we know they're struggling, right? But again, the challenge usually orang nak mau bercerita or share juga, like Tuan Ikhti was mentioning earlier, people are scared of being judged, kan?
Yani you hear about quiet quitting. I think quiet quitting where people performing at a minimum level,
correct, bare
not
minimum.
going beyond bare minimum, not go beyond. That's one of the indicators juga.
Correct.
Sometimes these are because of disengage, burnout, and stress and all that.
That's right.
And I think one thing yang that we don't notice is usually the high performers are the one that hides stress very well.
Correct.
And also the people the happiest are usually hiding them very well. So these are things that I would say supervisors or managers need to indicate. Sometimes we don't see that because they're just performing.
Okay.
That's fine. So those are the things that sometimes is good for supervisors to check in with the team.
And I think that's where building resilience amongst workforces is needed lah. I mean, there need to be regular check-ins. You really need to know, well, for the managers lah and the leads or the heads, you really need to know your people. Bukan face value saja bah. So you really need to know the ins and outs of their lives, their personal lives and whatnot.
In terms of mental resilience, I do believe that it's influenced by your work settings. So your workplace, I'm talking about on the organizational punya perspective. So I would say that it starts with leadership punya commitment. So if leaders genuinely care and prioritize employee well-being, usually it sets the tone for the whole organization. So when it comes to example, whether that's allocating resources to well-being initiatives, whether that's encouraging workplace work-life balance, or even creating environment where people are free to speak up, freely in terms of with respect, obviously. So that's very important. That's always, I would say, one of the pillar lah in terms of that. And probably I don't want to be too technical, but it's also important for organizations to identify psychosocial risks. Yeah. So this is organizations need to understand what the employees are actually feeling. So this or experiencing lah. So this could be by surveys. This could be done by feedback sessions, or even listening to the employees. Or exit interviews is also important juga. So there should be a mechanism to actually assess what the problems are in the first place. And then once we know what the problems are, then we assess them. So we assess them by looking at who's impacted, how serious they are, and then when we look at it, it could be in terms of the data that we collect. So it shouldn't be an assumption of what the organizations are feeling, what the employees are feeling. It should be driven by data. And then once we have that, baru we take action lah. So when we take action, we look at whether the problem is regarding, let's say workload. So whether the problem is regarding there's bullying, harassment happening in the workplace, whether there's issues with supervisor punya communications, leadership styles and all that, work environment, whether it's a safe environment to work in terms of whether they're given resources to work to do their role. So that's very important. So I do feel that resilience comes from the organization themselves, but it's also important for employees to, I think to practice. I think one is follow the procedures that's available in the organization. Two, I would say be open to speak up, but that comes with obviously the territory lah. But be open to speak up if there's problems and address I would say toxic behavior if you see any toxic behavior. Again, it's a collective effort between, I think, everyone lah in the workplace. And then one of the things that very, very important is to take action before it escalates. Itu very, very important lah. Because normally selalunya sudah really bad happening, barutah people take actions. So that's something that organizations need to be mindful of. Yeah.
Okay, just to repeat what you both have just said. Okay, so one way to discern whether someone is seriously going through either psychosocial health issues or mental health issues is typically, again, this is case by case lah, depending on the individual, but typically the person who is the most dramatic, the most loud, you can see like it's very performative, then that's usually not the case. If they can still be so energetic about it, maybe they're not possibly going through serious mental health issues, whereas the one that we need to look out for are the ones who suddenly have a change of behavior from very proactive in sharing ideas and very proactive in socializing, suddenly becomes quiet, they come to work, they clock in, they clock out, like as you said, quiet quitting. So that's the one that maybe either colleagues or supervisors or team leaders need to check on. And then as you said tadi just now, did we touch on the resilience part, how to build resilience? Yeah, so itu pun is very important as well, because this will go to my next question about resilience, Anikan, is that how can people then, because I want to highlight the importance of mental resilience as well, because if you have someone who is not mentally resilient versus someone who is mentally resilient, then in a workplace setting, that could also affect their chances of being seen, which is equivalent to being promoted, being preferred to work with. So macam I think that's also an important conversation to have. Yes, we want to highlight mental health issues. Yes, we encourage companies, leaders, colleagues, the right departments to look into it and to take care of these people. But if the individual themselves constantly gives in to, dorang punya issues then that could also get in the way of dorang punya career progression. Because in any workplace, I would also like to highlight is like you will encounter bad leaders, bad colleagues, especially office politics. You will encounter days where you have to actually do more work than you need to. So this is one conversation about mental health that people don't have enough of. Yes, we need to highlight mental health issues, but let's also talk about how we can build resilience. Yeah, what are your thoughts on that?
So I happen to be one of the psychological first aider. So one of the things that we've learned in terms of resilience is about coping. So one of the things that we've talked about, especially when people who's I guess experiencing, I won't say mental health, but people in distress. So one of the things that we ask them is, how do you cope? So what are your coping mechanism? So and then we also teach in terms of how to cope as well. So we look back what makes them, happy, what makes them feel away from work. What do you usually do? So that's one of the, I would say, mental resilience that we kind of encourage is in terms of the coping mechanism. Secondly, is we do encourage in terms of, I think, reaching out to people. So that's very, very important. Whether that's your supervisor, whether it's your colleague. Normally, based on our experience, they don't go so much to HR. So probably the least is
But is
HR.
HR the department to go to when people go through these things?
We do have layers. So the first layer is always about the colleagues and supervisor. So we always try to provide supervisor colleagues the ability to kind of how to talk to people. That's where training comes in. How to talk to people, what things to say. Most of the time, it's not about giving advice. Based on my own experiences, most of the people who comes to me personally are people not looking for advice. It's just want to be heard, to be listened to. Sometimes they just want to vent out, and then that's part of coping mechanism. I do feel that's part of resilience that we don't really see, but that subconsciously does build part of your resilience as well. Another thing is also about where supervisor comes in. That's where I would say people management skills is very, very important nowadays. The empathy, the conflict resolution, in terms of communication, even whether you want to answer or not answer or just listen, that's the listening skills, active listening. That's all important when it comes to supervisor. So I guess I would say probably one of the most important coping, it's about, reaching out. And that's why it's important for organization to normalize in terms of conversations around mental well-being, and the prejudices, the judgments, the should not be part of that. The stigma should not be part of that conversations. Another resilience is about making sure that you have people around you support you. That's very important. So whether that's family, that's friends, we need to have people who's I would say through thick and thin, they will be there for you without any judgment. Because I've seen a lot of people, those who's feeling with mental struggles, they don't have anyone to talk to. So they ended up giving up. They ended up saying that I'm useless. I don't know who to go to. I don't know what to do and things like that. So very, very important is about the community that you're with, whether that's friends or family and all that. So I guess it's important, Anula, for society to have that open conversation.
No
And it starts with
judgment
that.
as
Yeah,
well.
no judgment. That's Anula. So for personally, it's all about the coping side of the Anula, the mental health.
Eat healthily, balanced diet, make sure you don't skip meals or miss meals walaupun sibuk bekerja or whatnot, and make sure you sleep well. You must allocate time for your hobbies, your personal time. Keep your boundaries, make sure you have boundaries clear, not blurred or not negotiable. So basically your non-negotiables, right? So this helps for you to build your own resilience, your self-resilience and self-care. So what are your self-care? Apart from knowing, what are your coping mechanisms? I mean, believe me, some people in the tahu apa coping mechanism dorang sendiri, right? But it's a good exercise to actually list macam, okay, if I'm stumbled by an issue, for example, what do I need to do? What can I do? Sometimes listing things like that and actually acknowledging, oh, okay, these are the things that I can do, or these are my strengths, these are my weaknesses, and this is the sort of things that I need help with. That is also a way to actually build your resilience. Yeah, it's something that you can pick when you are stumbled or struggling with something. You have a go-to.
That will make you feel better.
Exactly. Sama macam tadi, the persons that you go to. Who are your cliques? Who are your people? Who are your tribes that actually can help pull you up when you're feeling down? That sort of things. So this is what we call safety plan pula. In mental health terms, we call it safety plan. So we need to have this. Even I myself have my own safety plan. Siapa orang geng-geng yang can call kalau I'm feeling down. Even psychologists do have their own off times, so normal, everyone does, so knowing this is really important. And obviously in workplaces, like Tuan Ethie was mentioning tadi, so managers, your leads, your heads or whoever, they need to have their colleagues, they need to have this in place, like safety plan. So if any one of us is feeling down or struggling with mental health issues or mental illness, what can we do to help to ease the burden, to ease the struggle atau? So that, however, do not come up sendiri-sendirinya kan. So it needs to be something orang discuss and openly, talk about, right? So that's the starting point. Kalau di workplaces, I do agree with you. To build resilience of a team and its members, we need to have these conversations going. We need to have the regular check-ins. And I think for leaders to walk the talk, sometimes leaders cakap, oh, ni kamu mesti cuma ni. Tapi they themselves forget to look after themselves. Right?
That's
Or
a good reminder for myself as well.
Oh, yes. Because I feel that too sometimes. Like I'm telling everybody, go home. It's Saturday. Kalau habis kerja Saturday, it's early. Berapa kamu di office Saturday? Work-life balance. Tapi diri kadang-kadang lupa. I'm still there, stuck answering emails and whatnot.
Relatable.
But it's something that's happening now. And I think that's why it's important for us to have, our go-to people, that people, who can have positive influence amongst us, and to remind us when we are feeling a bit down, there's somebody who can remind you, hey, look, this is what we need to do, or bawa you out car, and do something nice for yourself. And obviously kalau kita ni orang Islam, there's also that aspects lah, macam there's doa, there's bertawakal, there's also the spiritual side of things. So I mean, these are all the holistic ways of trying to build or encourage resilience in ourselves. So
I really do appreciate that you highlighted like self-care is also the individual or our own responsibility. Sometimes, if you don't take care of yourself, you really can't expect other people to help you if you can't help yourself, because that's the most important part,
I like to call it cookie jars, your cookie jars. I always ask kalau orang lah, or any colleagues or whatever, there's a how's your cookie jar today? Is it full or empty? Something that makes you feel good, jadi kan? I like my cookies, so hence the cookie jar. But so it's important for us to look after our cookie jar, our own well-being, our own spiritual health, if you like, our own, all those things. It matters.
Sometimes when we ask, what do you do to cope? So usually I spend with my family. I spend with my friends. I go, watch movies with my friends. So we always say no. What do you do? It's your me time. So it's always the me time.
As in when you're alone.
So you have to go back to that me time. It's always with someone. So me time is very, very important. So I think that's where
And I think maybe this is not a popular opinion because we think, like I said tadi, we ingaukan orang, we ingaukan what people say. When I talk about this with my friends, even my girlfriends, my go-to people, then they will say, nobody malu ke tu, sorang-sorang, When I was single, kena beritahu, macam mana dia orang berguna, dia sorang-sorang dating sorang-sorang. I said, aku dating sebab kau jangan
Yeah.
So my friends always go, are you sure? You're a bit weird, But see, that's the thing. Sometimes we need to be selfish with our time. Because like I said, well, maybe in my profession, because I look after others in my profession, so to speak, right? So I have to make it into a point, believe it or not, I actually put this in my diary or my outlook and say me time, nobody to disturb me. All right. And how often or how often or how frequent it is, itu depend on you lah. You know yourself better, right? So what I'm trying to say is a lot of time people feel they're selfish for wanting to have me time. But let me remind you, no, it's part and parcel of you looking after yourselves, and be more resilient in the long run.
Yeah, it's self-care.
It's
Right?
self-care. Yeah, I do that. I go to cafes and read books alone.
Right?
Yeah,
Okay.
it's
Ada geng lah,
it's very peaceful. But what about you, Tony Hiti? What do you do in times of stress?
So
What is
usually
your
breakfast time, I always spend with myself eating breakfast.
Ah.
So they always ask, you want me to accompany? It's okay.
Yeah, exactly. Right?
That's my me time. Usually just before work.
Yeah.
So that's mine. Yeah.
So we won't disturb you if we see you.
But I wouldn't mind. But
Yeah.
Yeah.
Okay, so we covered a lot in that one question.
Yeah. Oh, yeah.
So we covered the common workplace related mental health issues. We covered warning signs, which is which ties into the discernment punya conversation, and then how to not miss when staff, colleagues or your teammates are struggling lah. And then so this one I guess we can go into this one, but I think it's sort of covered jo today. The part where why do you think people delay seeking help? And if people talk about mental health here and there, does the stigma still really exist? Yeah, so and both of you who you can take this on.
I think honestly it's a mix of everything really. Macam apa? Several reasons I think why people are hesitant to actually seek out for help. So there's a mix of stigma, there's also fear, and as well, shame, as well as what you said earlier. I'll just tough it out. I'll just go through it. Jangan minta tolong orang. You just have to go through it. Don't show that you're weak or whatever it is lah. So, and then I think di Brunei. Well, I think globally pun kali jua, in many workplaces, there is still this unspoken rule that we, especially like I mentioned earlier, the younger generations, we're expected to be able to handle everything, right? So that's why kadang-kadang stigma ni it's very rampant. It remains as one of the significant barriers because individuals or most of our people are scared to actually open up about their vulnerabilities. Nobody wants to be seen as vulnerable, right? For the fear of being labeled as weak. Obviously, kalau orang mental, actually going through mental illness itu, lagi lah macam kadang-kadang feel gila. I'm not crazy. I don't think I'm crazy. But if I say, or if I share the struggle that I'm having dengan my boss, they probably think that I'm not suitable for this job. So, job insecurity or instability.
I think that's one of the major reasons.
Right, exactly. Or I'll get passed on for promotion.
Bonus,
correct.
performance, KPIs.
Exactly. So
attitude issues.
Correct. So there's all that concerns about dan confidentiality juga. Brunei ni damit.
Oh my
Sekarang
gosh.
ketahu orang semua, kena ceritakan, or if not my colleagues, orang lain, my parents, because we in the Ministry of Health, kadang-kadang one of the stumbling benar-benar block for us, people still think that we share information ni openly bah. Padahal everything that is recorded, it's confidential. So a lot of people says, karang kalau sekiranya, ini contoh parents I don't want my son or my daughter to actually seek out for help because karang payah kerja. Kalau orang masih sekolah, payah dapat scholarship karang kena taruh dalam
Ada record lah.
the record lah
Yeah,
basically.
yeah.
So again, I have to remind everybody it's confidential.
It's not in any record at all.
No, and then with mental health services, whether it's psychology services or psychiatry services, in order to get to our notes, whether it's the psychologist or the psychiatrist punya notes satu, they need to have a special consent. Nobody can buka our system, then everybody can lihat indah.
You mean internally? Okay.
Internally or externally lah.
Yeah,
Even
yeah.
macam ani I think I'll use this platform. In workplaces, when bosses reach out to us and say, "May we know what's going on?"
Oh.
That happens,
Yeah.
and then we will not entertain that.
Yeah, you won't disclose.
Disclose, kecuali the person who actually sought help from us actually give the consent. Then yes, we will ask the person, "Are you happy if you want us to share how in-depth are the reports?" Because that is part of the confidentiality of a person's punya ni lah. So special note lah when it comes to mental health, because we know how small Brunei is.
I'm glad you shared that because I am one of those who had my own reservations. Like if I go to Ripas or if I sort out therapy or whatever mental health issues that I need, like tahu ke ni orang, will they talk about it? Will they share?
Even going there, on the way there, or people would macam you need mental health
Yeah.
So that's the
So I
that's a
think
stigma.
that's how people find out more than
Correct.
from you yourself.
Correct.
People see macam bapa si Izzy sana tu.
This is another stigma or taboo that I need to address. Most people will think, kalau kena refer ke mental health services tu kena bagi ubat kotor. Not necessarily. Yeah, even if you got referred to a psychiatrist, it's all depending on the severity of the situation that you're in, right? If we think that you need to sleep because ada orang insomnia, payahkan tidur and everything like that, then I think we need some medication lah, punya treatment. Then then we will explain and get the consent and everything like that. We don't just nilly-nally give everybody aku nak mau makan ubat ni lah. So all these things into consideration to a certain extent, what's not putting off, but making people hesitate.
Think twice.
Think
to
twice.
go there.
This is what I think.
Yeah.
So
Well, thank you for the assurance, and now I hope people are more aware and feel more secure whenever they consider going to seek out help lah.
more comfortable to actually seek out for help.
Yeah.
Hopefully. And I think I'm using this platform, Izzy. It's important to actually, and this is what orang kata ni indah mawa, macam orang biar teh ada lagi orang much worse than me. Whether it's internally taking that or family members or friends and cakap ani barang damage je ni, you should just tough it out and dana saja, but I'd like to remind everybody that seeking help ani, we need to do it as soon as possible. We don't dilly-dally and then we tunggu tah sampai macam you benar-benar overwhelmed or benar-benar orang not functioning baru takkan seek help, right? So macam kata ni saja, charging your phone you don't wait until like 1%. Well, I don't know, maybe some people do.
But yeah.
But you get what I mean?
Yes.
So what more ourselves, what more us as a person, we don't wait until the last satu baru takkan, I need help, baru takkan seek help, right? So it needs to be done as early as possible. I believe in early intervention. So that's why for a person, if it's the workplace yang notice, right, organizations where they work at, is actually the one who's noticing that this person's actually struggling, it's important for them to go and reach out and help, rather than macam biar teh tunggu tah ingan-ingannya, whenever they're feeling it. So yeah,
I think that's also important in the workplace, especially when it comes. I think we talked about psychological safety just now. So that's about creating an environment where people are free to, I mean, not free, I guess safe to speak up without fear of repercussions or I guess blame lah. So one of the things that we realize is I think leaders play an important role. So when you see people who's, I mean, supervisors, ka, managers, apa, who's approachable, who's willing to listen, it's easy for employees to reach out to them. So usually one of the things that from our experience is, oh, I don't want to talk to Anu because takut kan kena marahi. So that's normal that we see in all organizations lah. I think the second one is in terms of looking at mistakes as an opportunity to learn. So that's something that's also important to have a culture of, especially in the workplace, a culture where, it's okay to make mistakes. You're still accountable, but we can support you in terms of how you can
Bounce back,
yeah, exactly.
how you can learn.
And then one of the things that we've also talked about is in terms of communication. So that's important where not just supervisor, but also colleagues, employees is also open to communications, to have an honest conversations within team. Usually, if you realize in terms of workplaces, normally the conversation is about performance, never about how are you, never
Yeah.
about, how's your family doing. It's always about, oh, you're not performing well. So usually the appraisal conversations mostly is about performance. Why you're not doing well? You didn't do this, you didn't meet the target. So seldom, there are some, I do see a lot of conversations increasing, but very,
Very
not
far
much
and few in
Yeah.
between.
to actually talked about in terms of, the heart of the conversations. So that's one
And then
thing.
talking
that we
about the actual
notice.
people, and then I think a lot of the time, Jua, well, it's better now than before, I suppose. I have to admit that. But when we talk about this matters, how to improve psychosocial health in workplace, and we need, by we, I mean the organizations need to remember that it's not all about fixing the employee. Kadang-kadang it's all about, when somebody has problem, the boss just send it on it, fix.
Yeah.
He's broken, so fix him, that kind of thing. So I feel that it's more than that. It's less about fixing the employee, but actually looking into the organization satu bat. There must be the root cause somewhere that needs to be looked at and that needs to be improved, right? So, but a lot of the time, you were saying HR, right? So a lot of the time, kalau ada people with problems, antar ke HR saja, let them fix them, But sometimes it can be the design of the workspace.
Exactly.
The culture.
It could be the culture. It could be the relationships.
Toxic colleagues.
Exactly.
Yeah.
So there's a lot of other things that we should be paying attention to.
I think another problem is they don't know how. They don't know how to, where to go to in terms of concern. So that's very important for organizations to put, I guess, processes in place in terms of raising grievances. So that's one thing in terms of support system that needs to be in place for an organization.
I think, and that's where the day, what we're celebrating, and is really important, because I do remember as well, macam from our side, the WHO, from your side, maybe ILO, we have like things to consider when it comes to the prevention of the psychosocial risk yang tadi ada you mentioned kan, at the source. So for example, macam we need to play an active role in improving our work conditions di Brunei ni, and to promote supportive leadership, and like you mentioned, to actually encourage psychological safety. So psychological safety is basically allowing people to talk about masalah instead of just brushing it down under the carpet and not talk about it, or instead of just sending people to HR to fix them. We really need to allow platforms where employees and employers can have that about platform to discuss about
that safe space.
Correct. If we don't have that, no matter how many yoga sessions or mental health awareness talk you're going to have in your organizations, but if you don't have that in place, we will not going anywhere.
True.
So there's a culmination of a lot of things or a lot of factors that we need to consider.
So a follow-up question to that is how then the individual punya side and the employer punya side make sure that it doesn't become Because sometimes when people feel safe to open up, right, they forget, because we're talking about, in the context of workplace, right?
Yeah.
How then do the individual and the workplace need to make sure that it's not, you're there to do work at the end of the day, bukan jadi tempat like, curhat. Because then that will take time away from work. It becomes distracting terpulang. And then if, you indulge too much, it becomes office gossip dia. So how can people balance that?
Well, I think for me, I mean, you can
Sure.
add on. This is where policies, workplace policies, should be in place. So that there's a sukat-sukat, like you said, that you can't spend an hour at HR per day talking about your issues,
Yeah,
right?
because accountability is also important.
Correct. So this is where like I said, workplace policies, or rather psychosocial health in policies in the workplace is important. And I think that's what we're gearing to between Shena, Ministry of Health, and other ministries that I mentioned. We are gearing towards that, having specific policies that actually allows people to share their troubles and whatnots, tapi at the same time have the necessary boundaries as to not overspill and do
there
all
you
those
go.
things.
Yeah.
So that needs to be in place. Recently, Ministry of Health and Jabatan Perkhidmatan Awam from Jabatan Perdana Menteri, under Jabatan Perdana Menteri, as well as Jabatan Buruh under Kementerian Hal Ehwal Dalam Negeri, as well as Shena. Okay, so there's these all important stakeholders working together in actually developing the first Brunei Darussalam work-life balance policy for all workplaces.
Wow.
If we are to come up with this one, I mean, we've identified people, key people from both government agencies and private players, private sectors, joining together to actually draft the very first work-life balance policy for all workplaces in Brunei. Satu for Brunei, the first one. And I think even for the regional ASEAN, we will be the leading country if we are to complete this in time. So we are currently doing that. We had our first workshop, a national workshop in January. We're currently going through it, reviewing some of the key issues yang highlighted during our discussions with all the representatives from the 12 ministries as well as the private sectors, industries. And we're going through it and we're developing it. So we really need everybody's support towards it. We're aiming to roll it out formally by next year, to complete the writing up by this year, and to roll it out next year, inshallah. Maybe for the next world, I don't know.
You never know. Yeah, hopefully. I think in addition to that, I think Shena is also in the process of developing a psychosocial risk assessment tool for all workplaces. So the idea is to have a structured tool to assess, manage, and in terms of identify risks, psychosocial risks in the workplace. So the idea is to move from reactive to proactive approach in terms of psychosocial risks.
And I think that two document is to work and support one another in going forward.
Sure.
When it comes into improving the psychosocial health di Brunei Darussalam punya workplaces. So it's a big thing.
Yes, it is. And I am very impressed that this is in the works.
Alhamdulillah.
This is something that is very much needed, and I'm so proud to hear that you said we will be the leading
country
in the region if we
finish and complete it. Yes.
Also, I think it's very important that when change is made, you have to expect some sort of resistance, which is normal.
It's normal.
And the hard will only get easier as time passes.
Correct.
So it's gonna be hard in the beginning. There will be some pushback.
Yes,
but
definitely.
Any change that happens will go through that in the beginning.
Correct.
So this will involve all the ministers. Sorry,
Yes,
not
all
ministers, ministries.
Yes, all the
And both
ministries.
public and private companies.
Yes, correct. So this is like
Very
a national guideline, if you like, for all workplaces in Brunei, both government sectors and non-government sectors, to actually adhere to.
Yeah.
So there are a few things. I can't share it here.
Yes.
I can't share it here yet, but they're very, very interesting points in the document.
I think all the teachers will be so happy to hear this.
Yeah.
And other ministries who's like, also going through a lot right now.
Yeah, because I can probably share a little bit, because it also talks about like job design and scope, work,
environment,
but
the work
environment,
environment.
all those things. So and it's adhering to ILO, the International Labour Organizations, and WHO recommendations. So hence why there's Jabatan Buruh as well in the picture. It's not only MOH pushing for this agenda, but obviously with the support from Shena as well. So I think they are the strongest, one of our strongest
Key players lah.
Key players.
Wow. Impressive. Thank you so much for sharing that big news. I didn't see that coming.
So
wow. Pretty
Inshallah.
exciting. Inshallah. Fingers crossed.
Oh yes.
The question yang pasal individuals who need support, what channel or resources, have we covered that, or is there anything any of you would like to add?
I think from my end, perhaps to actually share with everybody that in Brunei, ultimately MOH focus, Minister of Health's focus, is to increasing efforts on reducing stigma and accessibility to care. So along with it, encouraging people to seek out for help when needed. So in Brunei, there are several accessible options. We have our very own National Mental Health Helpline or Support Helpline, 145, Talian Harapan 145. It's open 24/7 and it's free and confidential. We have our mental health advisor on board, so people can call that 24/7 lah, anytime, any day. And then I'd also like to mention that one can go through government clinics atau hospital lah, which then can refer anyone who needs help to either psychology or psychiatry services within Ministry of Health. And again, these services are designed to be accessible, confidential, as I mentioned earlier, and obviously supportive for different individuals at different stages of need. It's there. And then I have to add on, Alhamdulillah, in the last few years, I think Brunei Darussalam, there are more private practices that actually offers help as well as compared to before, kan? But obviously, there are strict governing pula of all these private spaces lah. And if you need to find out more about this information, you can always access either from our Minister of Health punya website or Minister of Health punya Instagram handles, or even ours. My unit, we ran a Instagram handle called Mind Your Mind Brunei.
Mind Your Mind Brunei.
Yeah.
Okay.
So you can always access that, and we always share tips and strategies to look after your mental health or psychosocial health in workplaces, including managing psychosocial health in workplaces, among other things, as well as where to get help. Or even sometimes other people know I'm not comfortable in calling 145 yet. So they slide us DMs, and we also entertain those, like with questions. So feel free to go through our IG, Instagram handles. So that's one of the things that are in place lah within MOH punya realm.
But in the workplace, as you said just now, there are layers for, just to recap what you said, especially for employees lah. If they have if they're going through some mental health issues or difficulties, so the layer would be, first they try to speak to a colleague who can lend an ear, and then the second layer would be speak to supervisor, and then after that maybe then to the HR. Is that correct?
Yeah. I think that's one of the things that's very important is putting support system in place. So support system could be employee assistance program. So this is
that's right.
where it's employee, I guess, paid by the employers
to get help.
whether that's financial, whether that's what do you call that, counseling services.
Oh, as in like external. Okay, yes.
But it's funded by the organization.
The
That
organization.
could be one. Could be internal counseling services. Obviously, that will require trainings for the employee, and then even simple like awareness campaigns, mental health awareness campaigns or initiatives, because we do have that as well internally.
I mean, but it's true though, picking up on that, if you don't mind.
Yeah, sure.
There are a lot more workplaces that actually offers EAPs, employee assisted programs.
EAPs, employee assisted programs.
Yes, in the last few years, suddenly, we do come across with different organizations, both government and tapi banyaknya non-government sectors lah, that actually provide benefits in terms of paying for counseling sessions, paying for therapy sessions for the employee as part of the perks, right? Of the employment benefits. So that's great because kalau dulu nadahan langsung, but now people are more in tune, are more aware, and itulah to the importance of looking after your well-being in workplace. Obviously, when your people are being looked after, being taken care in a very good situation, in a very good way, obviously the productivity
will increase as well.
Will increase as well. So I think more and more organizations are realizing that.
And there's also policies as well in place in terms of addressing, harassments, bullying.
Correct.
So that's also important for the employees.
That's right. And for the harassment, I'm also happy to chime in and share for Brunei's punya civil servants department. They actually last year launched that. Like there's a specific guidelines on managing workplace harassment, which if we look back and track back, dulu dah ada tu. So I mean it's people are more open, people are more open and having that guideline, that document, in place, more and more people are macam feeling more secure, more comfortable in sharing kalau sekiranya lah they're experiencing any harassment or any bullying in workplace, right, compared to before, because there's a specific ways of, doing things
there's
now.
guidelines. They know how to.
Correct. Yeah. So they don't have to keep mum or to keep quiet about things. And get help, the right help. The right course of actions.
One last final question from me. The question says here, if each of you could give one message to employers, what would it be? But I think honestly,
we've covered that.
But now I would like to reframe the question.
Right.
If you could give one message to team leaders, head of companies who, again, like uses mental health just as a buzzword, tapi then don't really understand the weight of it and the responsibility that they have to take in making sure their employees are all well taken care of. What message would you give them? But also to them maybe too, because again, they carry the burden of running the company, holding such a huge position as well, especially business owners.
I'll keep it short. I think having a healthy psychosocial work environment does not require any complex programs in place. Usually the simplest steps are the most effective. So, looking at the workload, having supportive supervisors, and just creating an environment where people are free and safe to speak up. So usually that's very effective than having a full-blown programs in place. And one of the things that very important to, I guess, highlight is a collective effort. it's not just the employers saja, but it's also the employees, and not just that, it's also the society juga. We have to start. Basically, what the point of it all is, we have to start somewhere, and no better than to start now. So that's the message that I want to put to everyone.
To me, just remember, every one of us have our own stories. Everybody in this world carry their own burden. So always reach in to reach out. So,
Reach in to reach out.
correct.
Okay.
So
Love that.
I'll just leave it at that.
Yeah.
As short as that. But it's, if I'm to lengthen it, to add on, I do agree what Tuan Ithi was saying. We need to start creating a culture where it's okay to say I'm not okay.
Yeah.
And to be vulnerable is not a weakness.
Yeah.
Everybody face their own stories, like I said.
Yes. Yeah. I think that is so important for our generation to understand, because I feel like the younger generation are brave enough to say it,
Yes.
but then get blocked by
By
our
generations.
generation.
Yes.
You know, what is that? Is that the millennials, the boomers?
Yeah, you could
Our
say that.
what's after millennials? Gen Zs,
Gen
right?
Z.
Gen Zs.
But Gen Zs onwards, Gen
They're
Alphas,
fine,
they're
yeah.
fine. They're
They're
always
actually fine.
Yeah, they're always saying like, hey, you know, I'm not okay, blah 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 blah.
Correct.
But it's us who need to be more open and adapt,
Yes.
because we're not our time have passed.
Yeah.
We're living in their generation now.
True. I mean, it's hard to admit
Yeah,
it, but true. Yes,
they're
to
the
a
ones who's
certain
gonna
extent.
be carrying on the legacy
Correct.
for all of us. So we need to adapt to them.
Yes.
Maybe we can instill some, you know, because we do have mental resilience. I'm
Yes.
proud to say that.
Yes, yes,
Our
we do.
generation, we're the ones yang macam, bah, kalau ka na marahi, kalau ato, just suck it up.
Yeah,
And look at us, we survived.
Yes,
Alhamdulillah.
yes.
So maybe there's something that we can teach them too, but
Yeah.
also be
Yes.
open to learning from them.
Correct.
Yeah, because the reason why the discussion around psychosocial health and mental health issues are now being prevalent is because of them too.
Yeah,
So we
yeah.
have to thank them for that.
Correct.
Yeah.
Correct.
Yeah.
So
Yeah.
would any of you would like to add on to that?
Yeah.
I think that's it. You
Yeah.
actually,
Probably, Probably one thing is, you look at psychosocial health, it's not about, you know, making workplace easier
Yeah.
or making it
Correct.
comfortable. It's about making it healthy
Yeah.
and sustainable.
Yes.
Yes.
That's the key message.
Yeah, well done. That's a good one.
Yeah.
Yeah.
Thank you so much to
Great.
you both for being here today. I really appreciate the conversation, the wisdom,
Thank
the
you.
knowledge that you both have
Thank
shared.
you. Thank you for
The
sharing as well. Yeah.
insights. I am very
Yes.
excited for what you both and the other stakeholders have
Yeah.
in the pipeline,
Yep.
which inshallah, if everything runs smoothly, will be announced next year, is it?
Yes.
Yeah.
So we'll start. Well, the idea is to start socializing it by October, 10th of
Ah.
October, which is the World Mental Health Day
Okay.
this year.
Mm.
But to formally set it sail
In motion?
yeah, in motion next year.
Okay, thank you so much, guys.
Okay.
A
Thank
pleasure.
you. Thank
Okay,
you.
we're done.
Assalamualaikum.
If you reached the end of the episode, thank you so much for listening. I hope you gained so much knowledge and wisdom, as much as I have, in our conversation about psychosocial health and also mental health. I would also would like to thank Shena for sponsoring this episode, and I will see you again next week. Bye.